And it's true that by deciding to rebuild our Newport Health Center, that our board demonstrated its commitment to continuing to provide high-quality care here far into our future.
Okay, here we go. 1, 2, 3.
So what we did 13 months ago with the groundbreaking was to start the process, which is amazing that in 13 months we went from groundbreaking to occupancy. We've been in the facility now for 5 weeks. This is the formal ribbon cutting aspect. It's essentially double the footprint. It's all high quality medical grade space. We now have the capability of providing additional services that we were limited because of the size constraints, and so we're going to be adding specialty services. We're going to have 3D mammography here. We're going to have ultrasound services, and so we've enhanced the lab, the radiology. It will continue to be the primary care services with some secondary care and some specialists that today formerly didn't have space in the old building, and now we can have cardiology, oncology, services that are outreach, dermatology, neurology. We're actually exploring how to deploy specialists from New London and Dartmouth into this community so the community doesn't have to travel. The Dartmouth-Hitchcock vision is for regional integrated care, and they provide the high-end tertiary care. And if you think about it, the facilities such as a Mount Scottney Hospital or a New London Hospital are doing the primary care and the secondary care. So all the services that can be rendered at a local level, we want to be able to do for the community, including if that means specialists from Hitchcock coming out of the medical center and serving the community. And that's been our opportunity with enhanced space to be able to add some of the clinical services here in Newport. You know, one of the things that people are talking about in healthcare is this notion of accountable care organizations, which is really saying that healthcare is becoming more population focused. If you think about healthcare, historically it's been units of service and fee for service, and you bill for the units that you do. And hospitals are more and more being incentivized to provide high quality services to a population and to actually keep people well, to keep people out of facilities, which is sort of the exact opposite of the old mantra. The notion of an ACO is actually Medicare and other insurers are encouraging healthcare providers to take a bit of an economic risk for a population and try to encourage the providers to keep people well and to keep people out of their facility. And that's very different, and that's how it fits within the Dartmouth model. As you know, if they're going to be the tertiary medical center, we are going to continue to be providing the primary and secondary care, and ideally not having the community members need those specialized services. If we keep people well, the goal would be to keep people out of the facilities and actually be able to be compensated for that effort.